Okay.
You can hold on to it until the end. I'll give you the post-test at the end. Got it?
Yeah.
Okay. So to start off, I'll just kind of go over seizures and epilepsy. You know, a seizure is just a disruption of the brain's electrical activity. You know, there's always electrical activity going on in the brain for anything, any movements, any thoughts, anything that you do. The seizure is just kind of a disruption of that, an abnormal electrical activity. And a seizure can happen to anyone, and then epilepsy is when the students are having recurrent seizures, or mostly if a person has had more than one seizure in their lifetime. And more than half of the time, the cause of the seizure is unknown, so they don't really understand why people have seizures or what they're caused from. But the most common things for the ones they do know are from like a head injury or genetic factors. They're born with an epileptic disorder. A brain tumor can cause them, or a brain infection. And like I said, anyone can get a seizure at any time. I know you guys probably know your students that have epilepsy already or diagnosed with it, but it could happen to any of the other students at any time, even if they've never had one in their life. Even people up to over 65 years old, never had one in their life, can start having epilepsy or having seizures. And then it's mostly diagnosed through eyewitness accounts of people observing the normal seizure behaviors, and also neurological exams such as an EEG, and they'll do tests with them overnight. Or I don't have a seat. Here, I'll give you one of these. You can move the chair if you want. Okay, and so the different types of seizures, there's a bunch of different types. We mostly normally think of the generalized tonic-clonic with the whole body shaking. There's multiple other kinds. There's two categories, generalized and then partial seizures. The generalized seizures, the number one is the tonic-clonic, where the whole body is shaking and contracting, muscles are contracting and releasing. And it's jerking movements, convulsions, and muscle rigidity. The other generalized seizures are the absence seizures, and those are obviously going to be more difficult to detect in students. And those are just characterized by blank staring, their eyes rolling back, might look like they're daydreaming, or blinking. And those seizures, you'll be able to tell if a student is daydreaming or actually having a seizure, because when they're in that absent state, the absent seizure, they're not going to hear you, they're not going to comprehend what you're saying or respond to you. But they last a very short amount of time, so just a few seconds, usually not more than a minute, and then they'll kind of come back to it, and then won't remember what happened during that period of time. They won't even know that they had a seizure. So so those are definitely harder to notice what's going on, especially if it only lasts less than a minute. If you're teaching or if you're in class with someone, you might not realize that they're actually having a seizure. And then the other partial seizures are complex partial, and that is when that's also can start with blank staring, but the patient can, or the student can do a bunch of different things. They might walk around, just like kind of out of it. It might look like someone, not your students, but someone else in the, an adult. It can look like they're drunk, or they're on drugs, or they're really out of it, even like they might have a mental disorder, but really they're actually just having a seizure. And it's kind of on the back of here, it goes into more detail about the different seizures. Those complex partial usually just last a few minutes, so they're last a little longer than the generalized absent seizures. And then for the first aid for those seizures, I have some handouts. First we'll go over here's for the generalized. And this is for the generalized tonic-clonic. But for any seizure, how you want to handle a seizure is not to panic, especially with your students. You know, with epilepsy, they're very common. I'm sure you've probably all seen them before. But you don't want to panic and get everyone else in the classroom panicked. You want to remain calm. You want to note the time that the seizure starts, because a lot of the students will be prescribed Diastat. So you want to note the time for that in particular, because you want to know when to give the medication. But also, anyone who has a seizure, anytime it should be timed. And then with the generalized seizure, like it says on here, you want to measure the time. You want to cushion their head and turn them on their side if possible, if they're on the floor, because that can, if they're on their back, their tongue can go back in their airway and block their airway, or even their saliva. So if you lay them on their side, they can keep their airway open. Their saliva can go out the side of their mouth, because you don't want to put anything in their mouth at all. So you just want to let them seize and let them just keep their mouth clear. You also want to cushion their head if possible, and if they wear glasses, remove their glasses, so you don't want them to injure themselves any further. And like I said on there, you want to loosen tight clothing. You don't want to hold them down. You don't want to try to stop the seizure, because nothing, once it starts, brain activity, nothing you do is going to stop it, like the holding them down or trying to restrain them, and you could just hurt them worse or hurt yourself, because you don't know, their arms could be flying or the legs kicking. So, and then so that's for the generalized tonic-clonic seizures. And then here's kind of the complex partial seizures I was talking about as well. They might have different, as you can see at number 1, they might have different actions that they will be doing that are just kind of strange, like confused speech, shaking, wandering, fumbling around. They might be smacking or chewing, something like that, blank, or just blank staring. So with these seizures, it's a little different, because they could be walking around. They're not going to be on, laying on the floor. You don't want to. They can become, if you try to restrain them or pull them down, they can become combative. So you just kind of want to guide them into a safe area, be reassuring and calming, be a calming presence to them, and explain to others what's going on, just so that the person having the seizure doesn't, they're in a different state of mind. They could act out or become combative, like I said. So you just want to be calm and reassure them. Then other first aid, it says on the second page, when to call 911. So not every seizure is a medical emergency. Like I said, a lot of the students have multiple seizures. They're a very common occurrence with them. The EMS does not need to be called every time, but you need to know specific situations where you do need to call 911. And that is, if the seizure lasts longer than 5 minutes, you definitely want to call 911. And a lot of these students that you have who are diagnosed with epilepsy and are prescribed Diastat, they have different times, and I'm not exactly sure what times these students are ordered. Some students I've seen is up to 2 minutes of a seizure and they want you to give Diastat. A lot of them aren't until 5 minutes. So if it's something at 2 minutes or 3 minutes and someone's giving Diastat, then you definitely want to call 911 if they're given the medication. And also, if they do not resume normal breathing after the seizure, so if they're having difficulty breathing or short of breath or very slow respirations and it doesn't look like they're getting adequate intake, then you want to call 911. Thank you. And as far as the timing goes with the seizure, like it says, call after 5 minutes, and that does not include the period after the seizure when they're in the postictal state is what it's called, when they're very tired, groggy, they still might be out of it, but they're finished having the seizure. Do not count that in the timing of the seizure. They're going to be out of it for a little while afterwards. A lot of times, you know, everyone would be different, but that's not counted in the time. That's expected. So you don't need to count that in the time as far as calling 911. And if someone doesn't have a medical ID bracelet, if they're diagnosed with epilepsy, a lot of people will wear them so people know that this is normal for them, or you know, they've been diagnosed with it, they're being treated for it. So if they have a medical ID bracelet and they're having just a short 1-minute seizure, you don't need to call 911 because it's probably something that they're used to having and they're going to recover from it. If there's an obvious injury, then you want to call 911. If they're pregnant or diabetic or the seizure happens in water, then you want to call 911. And then of course it says at the bottom, if the person requests, then of course you call 911 for them. The treatment of epilepsy, a lot of times, I'm sure a lot of the students that you have here are taking medication for it, so they could be on multiple medications to help control the seizures. So that's the most common thing that can help keep the seizures controlled. There's also surgeries that can be done, the lobectomy in the brain. That's not as common. Obviously, that would be kind of like a last resort thing for the patients. Vagus nerve stimulation is another. You can read about that. And then also a ketogenic diet. I'm not sure if any of your students are on that. Does anybody know? No? Okay. So that is a lot of times used in children to help control seizures. Another way, something that they use. And like it says, it's a high-fat, low-carb, and low-protein diet. Okay. All right, next I'll go to the common seizure triggers. These are just things you can be aware of in the classroom or even outside. Strobe lights is a big thing, or flickering light patterns, and something like, of course, if there's a strobe light going on that you'll notice, but there's some like little things that might not be as obvious, like a computer screen if a student's staring at it all day, or a TV. You know, there's constant flickering. Also, you know, if the fire alarm goes off, those lights flicker, or you're having an assembly, you know, there could be lights going on and off that might trigger a seizure for them. The other things like lack of sleep, you know, that could be something with students. They're staying up all night, not going to bed like they should, or too much caffeine. Hopefully, these students don't have a lot of caffeine for your guys' sake. Or brain disorders, which some of the students could be diagnosed with, and even female hormone fluctuation, which might not be so prevalent here, but then when they get a little bit older, they might start to have that become a common trigger. And some people can feel an aura, it's called, and kind of feel the seizure coming on, and they'll know they're going to be having one. So if one of your students does have an aura, it's good to know exactly what that is, and then to have them tell you when they feel that, so that you can get them in a safe place, you know, on the floor, resting, so in case it does happen, you know, they're already, I guess, in a more, not going to be as prone to injure themselves. And then I guess the only other thing is for the students, just student support. Number one, to reassure the students that have seizures, to make them feel comfortable and not like they're different, or to leave them out because they might have a seizure. You know, it's not going to stop them from playing at recess or doing different activities. You know, I want them to make them feel as welcome, or, you know, included as possible. Also, just to know the individualized student plans, and I'm not familiar with any of the students here, so I'm not exactly sure what type of seizures they have, or, you know, what kind of common triggers or auras they might have, but it's good to get to know the students that you're going to be working with every day, just to know, you know, when when they're prone to have seizures, how often they might have seizures, what medications they're taking, just, and then kind of course, what their seizures look like so you can recognize them a little bit better. And then also with the absent seizures, if any of the students have those, it's important they might be kind of spacing out like we talked about, or like look like they're daydreaming and they're not going to hear anything that went on in the classroom during that period of time. So they're going to not learn or not understand what was taught in that period of time. So it's important to reassure them and reteach them, not make them feel like, you know, it's their fault that they didn't learn it because, you know, they weren't in a state of mind to be able to learn it. All right, so are there any questions about the emergency, you know, when to call 911 or the different types of seizures, what to look for?
Did we miss the whole thing? I'm good.
I'll do another one.
Were there? I thought there were two.
Yeah, there's two.
You're early for the second. Yeah. You can say that.
Yeah, we started a little late, so. That's okay. Do you guys have any questions specific to your students, if you know what kind of seizures they have? Or?
I noticed in here that it says if they're in a wheelchair, just to leave them in there.
Yes, that's correct. If they're in a wheelchair, you want to just leave them in there. If there's anything in the wheelchair that they could hurt themselves on, if they're convulsing, you can try to pad those areas so they don't injure themselves. But you know, don't get them out of it because that could injure them more or injure you, especially if they're, well, I guess most of your students are littler. Anytime that someone's having a seizure, you want to help them to the ground and you don't want to move them. You can move everything around them, chairs, tables, desks, students, but just let them be where they're at, because the less they're moved, the better chances no one's going to be injured, yourself or the student. And then, you know, if they're having a seizure and you go get the nurse, or if there's no nurse, whoever is designated to give them medication, you want to, whoever else is in there can try to move the other students out of the room and just kind of explain to them. And there's in here kind of says what to do, how to explain to the other students about a person having a seizure. Just reassure them, try to stay calm so that they don't feed off your excitement or nervous anxiety, I guess. Any other questions? No? Okay. Yeah, if there's ever any question about whether or not you should call 911, if you don't know for sure, you know, always feel free to call 911. Be on the safe side. Especially if you notice a student that you didn't think was diagnosed with epilepsy, you've never seen had a seizure before, if they have a seizure, then have them call 911. It's their first time. Or even if you don't know if it's their first time. Alright, well, I think that's it. I'm going to give you the post-test. You missed the pre-test, but I'll give you the post-test anyway.